This is a Power 98.7 podcast. Now we're talking. Subscribe to Power 98.7 podcasts in iTunes or wherever you get your podcasts. There's more on power987.co.za.
Indeed it is, and it's 23 minutes to 11. As I said, we are on the line. Dr. Meshack Mbokota joins us, gynecologist, to talk about, whether pregnant women are at a greater risk of contracting the virus or whether infected mothers pass it down to their babies. I'm sorry. Dr. Mbokota, good evening to you. How are you, Doc?
Good evening, Dr. Mbokota. How are you, Doc?
I'm very well. Thank you for your time, sir. Much appreciated.
So thanks, and thanks for having me.
Sure, thanks, bro. So I'm sure you are getting a lot of concerns from fathers-to-be and mothers-to-be in the midst of this COVID-19.
Yes, there's a lot of anxiety, a lot of worries. If there's any illness, the one thing that we always want to know is what does it do to a pregnant woman? Does a pregnant woman become more sick? What does it do to the unborn baby? What does it do to the newborn baby? So those questions are coming, and those anxieties don't make it easier.
Yeah, and what are the answers, Doc, just to cut to the chase?
Look, I think to just cut to it, that firstly we must just recognize that this is a fairly reasonably new virus, and the information changes quite constantly. But fortunately, part of the information has been gathered from the previous outbreaks of coronaviruses. If you remember the MERS virus in 2012 and the SARS virus in 2003, they are similar viruses to the current one. And so a lot of the information comes from there, and it seems to be corroborating what has happened then. Just to start off with, is that generally pregnant women are not necessarily more susceptible to any viral infection than the average person. But, and that's a big but, every pregnant woman, their immune system is depressed during the pregnancy. And therefore, should they get an infection from any virus, including COVID, then their symptoms are much more severe than the average person. They complicate much quicker, and they deteriorate much quicker. And that's why pregnant women are placed under what we call the high-risk category of people. So for lack of a better word, so if a person is pregnant, the best thing to do is, as much as possible, avoid the infection if you can, and therefore try and stay away from crowds. And in that way, because the complications are similar to everyone, I think everybody knows that so far science has not been able to actually find a tablet or an injection that basically kills the virus and it doesn't harm the person it's infecting. So you rely on the person's body to fight the virus. So if your immune system is already depressed, your body then takes longer to be able to fight that virus. So that's the first thing. The second thing is that there has been evidence that some pregnant women have experienced unfortunate incidences where they have to be delivered prematurely because of the condition of sometimes when they are very sick themselves and they need to be in ICU. For us to be able to ventilate them better, you have to now relieve them of the pregnancy, meaning remove the baby prematurely so that they can be taken care of much better. And thirdly is that the illness seems to get worse and more serious in people who are above 28 weeks of gestation. And that simply is because as the pregnancy grows, it compresses the lungs. So women, as they advance in pregnancy, their ability to breathe just gets more difficult. And so when the virus then attacks the lungs, it just makes life much more difficult for them.
I also think that we should not forget that the responsibility that also should be taken by the fathers-to-be.
Yes, I think the fathers-to-be are critical in the sense that one is that they should not be the source of the infection, first of all. And therefore, they need to be responsible. But at the same time, they should not abdicate their responsibility to be a caring partner in the situation.
Yeah.
Because if you can imagine now, a lockdown was implemented. The husband was in Cape Town. The wife is in Guyana.
Yeah.
It's tough. It's tough.
Yeah. Plus, it's an intimate. It becomes too intimate when your wife is pregnant. You must always be there. You must always be closer. When those feet get swollen, you should be the first person to try and rub those feet. Massage those feet and stuff.
And therefore, these general basic rules of hygiene, of washing hands, and making sure that regularly washing hands, maintaining a social distance. We hope people will be able to maintain it while they are locked up in their houses. We will see the result of that in December, January, if that has happened.
But isn't that the problem again, Doc? That the same women who are pregnant from time to time, they must go to a clinic. And we know that this virus has got a habit of hiding for 4 to 5 days, or you guys say 3 to 5 days before it shows up.
The incubation period. I think let's get to that, and because it is still important that they should attend the antenatal care, and therefore those who have to attend, and they must attend, because that's the only way in which we can at least satisfy the well-being of the baby and the mother. So the visits then become a little different, because then they need to phone in advance. They're going to find that the spacing at the clinic is much more wider than usual. So the chatting that they're used to having with their friends is much more difficult. Then the putting on the masks, making sure that they have their hands sanitized, they don't touch their faces as often as without washing their hands, and to make sure that the partner, if he comes, he also needs to maintain that distance, and then they spend as minimal as possible a time at the clinic, which then means the scheduling of those visits need to be such that they are not there sitting outside or sitting within the room for over a long period of time.
Yeah, because this is real, Doc. I mean, there was a case of a pregnant nurse, I think, in the UK who passed on. So there's already a case study there.
I mean, she's one of those who she has passed on, and there was two in Wuhan in around January when this thing started. So it's not something that is being postulated. It's something that's real.
Yeah. Let me tell you what I would ask you if my wife was pregnant. I would ask if it wouldn't be feasible for her to stay home for at least a month. So until the dust settles a bit, not in the midst of this this coronavirus and what the experts are telling us that the worst is still to come. Would it be a good idea to say, yes, I was scheduled to go to the clinic next week, but just as an extra precaution, maybe I must stay off a bit?
Yeah, the difficulty with that is that then the way in which the monitoring of the pregnancy becomes more difficult. How that can be achieved is through collaboration with the obstetrician or the midwife who's looking after her, whereby certain tests can be done. I mean, she can go and have her blood pressure tested at the local pharmacy, and then those results can then be sent to the obstetrician. But the best way of doing it is when they phone in and say, okay, I'm so and so, I'm going to arrive at such and such a time. So the times that the appointments are made are so spaced such that the one patient doesn't find another. So, for example, what I've done over the past, since this thing started, instead of scheduling my patients every 30 minutes, I schedule them every hour, so that I finish the one in 30 minutes and there's a space, so they don't even meet at the gate, at the door. In that way, you limit the number of people in the waiting room. You limit the number of interactions in there, and that whilst you are able to provide them with a service to make sure that those babies are well looked after. Of course, it may be a bit difficult in the public service, but it is doable because we've seen it that they've managed to space out the seating so that they even push the seating to the outside in order to make sure. And then they change appointments. Say instead of seeing 20 people today, you see 10 today, 10 tomorrow, and 8 days. If that clinic used to have antenatal clinic only twice a week, then it must have it 4 times a week in order to assist those mothers.
So you see, Mangi on Twitter says, we have a 6-month-old baby who needs to go for injections. Please ask the doctor, for how long can we postpone? I don't trust the clinic.
She shouldn't postpone because those vaccinations are just as critical as it would be if she doesn't vaccinate the child. So it's probably vaccinations against measles and probably polio and DPT or diphtheria as we call it. And so if she can't skip those vaccines, again, it's a question of picking up the phone and making arrangements to go. Alternatively, you phone the pharmacy. There's a sister at the pharmacy. My baby has to come for these injections, and then they can rock up at an agreed time and have the injections done and go back home.
So the best option, I suppose you are saying, if indeed she doesn't trust the clinic, is the pharmacy.
Yes, and the best, again, there's nothing that beats. This virus takes infection control back, puts it back to basics. That the only way we can control this virus is by us. You literally infect yourself because it gets onto your hands and you put it in your face. If you get closer to a person when they speak, it's the droplets that get to you. So if you've got a mask on and you know how to treat the mask without touching the front or the back of the mask and all of that, you are able to protect yourself, and you can do that for the child. But you can't then skip critical things, because when that child needs to go to school, they need to see those injections, but not only for that, but it's also for the health of that child. Because if the child gets measles tomorrow, it's going to spread the measles, which spreads much faster than COVID.
As a parting shot, what's your advice to people that are expecting babies, Doc?
Yeah, the parting shot is that one is that, yes, the virus can actually affect the baby whilst the baby is in the mother's womb. And fortunately, the babies who've been affected early enough, when they are born with a bit of immunity to show that they were infected. But the difficulty is when a mother who is COVID positive delivers a baby while she's ill, and the baby has to be separated from her, and she's unable to breastfeed. Because, yes, she can express the breast milk, and then it's given to the baby with a bottle, but at least until she's cleared of that, the baby can't be brought to her for her to breastfeed for the fear of the baby getting infected. And if we observe, again, the basic rules that is being preached in terms of washing our hands, sanitizing them, making sure that we maintain a social distance, pregnant women should also be able to go through this. It's just that we must remember that they are slightly more at risk. And finally, with the flu season approaching, we also advise them that they should go and get a flu shot so that they don't get confronted with 2 viruses, one flu and one COVID at the same time.
Thank you, Doc. Thank you for your time. We really, really appreciate your insights.
Thank you, Dr.
Thank you very much. That's Dr. Meshack Mbokota there, who's a gynecologist, saying that pregnant women are in the high-risk category.
You've been listening to a Power 98.7 podcast. For more podcasts, visit power987.co.za or subscribe wherever you get your podcasts.